Awesome. Okay, so, all right, substance abuse. Well, it's like substance use and substance abuse, and addiction, and dependence, and tolerance. There's all of these words that we're going to go over here. Hopefully I can kind of delineate amongst them. It gets a little bit sketchy, like addiction and like dependence, that's going to be a little bit sketchy, but hopefully I can help with those definitions. Okay, so just to start, all right, so, all right, in regard to talking about this, we got to talk about natural rewards, because the main neurotransmitter, and again, when it comes to substance use, a variety of neurotransmitters are going to be released in excess when somebody uses substances, but the main one is going to be dopamine. And so when we talk about dopamine, dopamine is even going to be released when we do the most, what we assume is going to be the mundane things in our lives. And so even when we like eat food, drink water, have sex, and then also like nurturing or like comfort or shelter, dopamine is going to be released because those things are going to keep us alive and enhance the survival of our species. So when we do those things, yeah, we might feel pleasure, and what the dopamine is going to do, dopamine is going to be, as we've talked about before, it's going to be it's the pleasure chemical, and it's like the reminder chemical. So what it does also, and there's like muscle movement and things like that. That's not as important here. But when dopamine is released in the brain, it's going to cause a pleasurable effect, so you're going to feel good. And then it's also like, it's going to create a reminder that like, hey, this felt good, let's remember to do this again. Again, that's helpful with food and water because it's going to remind us to do it again, thus keeping us alive. But when we talk about these natural rewards, they don't necessarily release like high amounts of dopamine. So it's not the same as like if somebody uses cocaine or heroin or something like that. It's going to be lower levels. So in regard to dopamine release, like tacos is not going to be the same level of dopamine as like heroin. But tacos are great. So when we talk about the reward pathway, and again, this is applicable for both like tacos and heroin or water or alcohol or whatever you want to call it, that is going to cause some aspect of pleasure experience. We call this the reward pathway in the brain. And so the reward pathway is going to include the ventral tegmental area, that's the VTA, that's going to be kind of like at the base of the brainstem. You also have the nucleus accumbens. That is going to be toward the front of the brainstem, and then it's going to include the prefrontal cortex. So this is the pathway in which dopamine is going to be released that's going to cause pleasure. And yes, it's connected via neurons, and the ventral tegmental area is basically where the dopamine is going to be derived and stored in the brain. And so when the nucleus accumbens is activated, that is going to, or the VTA or the nucleus accumbens is activated, that's going to release dopamine through this pathway, thus also activating proximal areas, so like the limbic system, as well as a variety of areas in the prefrontal cortex. Yes, it's going to be activated by a rewarding stimulus, whether that be tacos or water, things like that, or narcotics. All right, when it comes to this, we were able to discover this reward pathway through research with rats. And what we did is we put basically a stimuli or like a needle into the rat's brain, into the nucleus accumbens, and there was like an electrode that was associated with this needle. And then what happened was that because it was in the nucleus accumbens, every time the rat pressed the lever, it gave a shock into the nucleus accumbens, thus activating it and releasing dopamine. And what they found is that when that shock was elicited into the nucleus accumbens, activating it, dopamine was released, and so that rat continued to push the lever. When that electrode was placed elsewhere in the brain, rat didn't continue to push the lever because it didn't feel good anymore. So that is how we were able to determine this reward pathway. All right, and this slide should be further down, but it is here, so this is where we're at. But addiction is a concept that we talk about, obviously, when it comes to substances, but it's a state in which an organism engages in compulsive behavior, even when you're faced with negative consequences. So this could even be like, all right, somebody is compulsively using heroin and they don't have any money to get heroin, but they're willing to go out, maybe steal something in order to purchase their next fix of heroin. And they know that that's not good, but they do it anyways because, again, they need to ingest that heroin. That's going to be part of addiction, is that compulsion. And again, that compulsion to use is reinforcing. A major feature of addiction is the loss of control and being able to limit the intake of the addictive substance. So even if you know, like, again, maybe you're addicted to cocaine. And so even though you know you're going to get random drug tested at your job, you continue to use. So you have a hard time, even though you don't want to, you have a hard time limiting that usage. And with the most recent research in the area of addiction, it's kind of interesting because this reward pathway that is activated by the usage of drugs is also activated in the craving stage of drugs. And so just craving and that anticipation associated with you're going to be using a drug is actually comparable to the reward itself. So that's also important, and we're still learning more as well. Okay, so that's addiction. We'll talk about dependence and tolerance in a hot minute here. But let's talk about heroin. All right. I'm just going to break this down for you all a little bit. All right. So, okay, there's two classes of drugs here. And heroin is going to be included. So, dang it. Come on, there we go. So we have opiates and we have opioids. All right, so now opiates are going to be naturally derived from the poppy plant. And yes, this is the poppy that you think about. So poppy plant is going to be harvested, and from that harvesting, you can derive opium, morphine, and codeine. Those are going to be the natural derivatives of the poppy plant. And then when opioids are further derived, we call them opiates, or synthesized for that matter. This is where we get heroin, we get fentanyl, we get Vicodin, we get Oxycontin and oxycodone, we get hydrocodone. I think I'm missing something there, but it might come to me. These are all opioids. And so when we're talking about heroin, which is derived from morphine, truly we're talking about really any opiates or opioids are going to have a similar effect on the central nervous system. That's just going to be at various levels. So for example, if we're talking about heroin, yes, it's going to have it's going to activate a variety of areas of the brain, but if you're using fentanyl, on the other hand, it's going to do that even more so. There's also a derivative of fentanyl, and I need to get the meme I have of it because there's an image online where you can see the the fatal doses of each drug, and there's a fatal dose of heroin that it's like, okay, there's in the test tube there's like quite a few grains of sand. Fentanyl, maybe a quarter of that in regard to a fatal dose. There's also a derivative of this that's called carfentanil. And in that vial, there is 1 grain of sand, indicating that carfentanil is extraordinarily deadly if one were to ever use it. It's going to kill you. So with that, I would also conceptualize it as a weapon of mass destruction, and if anybody ever aerosolized it, it's going to kill a lot of people. Don't take this as like a tutorial as to how to kill masses of people. But it would, if they ever learned how to like aerosolize it. I will find that image and show you guys. Okay, heroin. Again, any of these that we're talking about, we're going to do the same thing in the brain. Really quickly, I forgot. Poppies. Yes, I know like people tattoo poppies on themselves. I know it has an important meaning to a lot of people, including like veterans. Poppies are going to be primarily, they grow the best in places like Afghanistan, so the Middle East has good crops of poppies, and then it rolls over into like Eastern Europe, so like into Turkey, and then down into Southern Asia. That's where you're going to find the biggest poppy, like where most of the poppies are going to be harvested from. And hey, how's it going? And in regard to even like Afghanistan, where we get most of like your like morphine, opium, codeine, it is the basis of their entire economy. If like the opiate trade were ever to collapse in Afghanistan, it would collapse the entire country. So the basis of their economy is literally opiates, which is pretty crazy. So that's where a lot of our opioids come from. Okay, anyways, back on to action heroin. It is an addictive drug, but here's what's interesting about this, and it's hard for me to conceptualize because heroin is, any of your opioids are incredibly addictive. Nope, there we go. But there are people out there that do not become addicted to heroin. This could be due to environmental or personality or genetic characteristics, and that they just, they don't have an addictive personality. They have no addictive genes. And they can literally like recreationally use heroin. They could be a fully functioning professional, and then on Saturday night they're like, hey, I'm going to use heroin. And then they're totally fine on Monday morning. These people fascinate me. Totally fascinate me, but I unfortunately do have a very addictive personality and am an addict myself, so it's hard for me to conceptualize this. But yeah, there's the possibility that some people do not become addicted to heroin. I'm going to say don't try this out to see if you are. But heroin, yes, it produces euphoria or pleasurable feelings, absolutely. What's been explained to me is like the first time somebody uses heroin, it's the most pleasurable experience they'll ever experience in their entire lives. And then that is also part of the reason that people will try to continue to use it, because they're also always chasing that first high. And they will never get it. It can be positive reinforcer by interacting with the reward pathway in the brain. Yeah, your reward pathway is absolutely going to be activated, and so as a result of that, you're going to feel really good, and that dopamine is going to be released, so you're going to feel good, and that's going to do a reminder like, hey, heroin felt good, let's do this again. Okay, so when it comes to heroin, what happens here is when we have natural opiate receptors in the brain. They're associated with endorphins. So for example, if like I were to like step on a nail, what's going to happen other than it's going to hurt? The reason that it's going to like lessen, the pain will lessen, one of the reasons is because there's going to be endorphins released basically in the same area as opiates are released. And those endorphins are going to bind to opiate receptors, naturally occurring opiate receptors in the brain and spinal cord that's going to offer like an analgesic effect. So it's going to decrease your pain levels. That's naturally occurring in our central nervous system. And so when you use an opiate, what's going to happen is that the opiate can literally, well, when it comes to heroin, enzymes have to break heroin down into morphine. So you got to get it back into morphine. So you got to get it from an opioid to an opiate. You don't need to know this, but just for the sake of correctness. But what's going to happen is that it's going to be derived into morphine, which can then attach to those natural opiate receptors in the brain and the spinal cord, thus producing that pleasurable effect as well as the analgesic effect. And this kind of explains why when you get your wisdom teeth out or you have some sort of surgery, that the doctor is probably going to give you some sort of opiate as a pain reliever for 7 days. They're not going to give you 100 pills like they used to. But you might get Vicodin or OxyContin or oxycodone or hydrocodone. I think hydrocodone is kind of where they go more often than not. And that's because of the high-powered analgesic effect of opiates. Or morphine for that matter if you're still in the hospital. You might get a morphine drip. And again, that is because of the analgesic effects of these opiates. Okay, now when it comes to the ingestion of drugs, and I apologize because I'm probably going to go off on a lot of this because I used to teach drugs in society. I think it was my favorite course to teach, and so I do kind of add a few things here. But in general, most people are going to inject heroin, whether that's black tar heroin or powder heroin. That is, again, that's going to be the most common ingestion route, but there are people out there that will smoke heroin as well. The difference between the smoking and the injectable is that both smoking is probably, smoking and injection are pretty similar in how fast it gets to the brain and so how fast somebody feels something. The biggest difference is that when somebody injects the drug, they're not losing any of the drug. They're able to include all of that in that syringe and inject it, whereas when somebody smokes a drug, like heroin, literally a lot of it's going up in smoke, so they're losing a certain amount of that drug. And that's commonly why, even with methamphetamine, a lot of people will start out smoking meth, but then they will graduate to injection because it's going to be that greater or longer of a high because they're not losing any of that drug due to it going up in smoke. I've never met anybody that snorts heroin. I'm guessing that's powder heroin and not black tar heroin. You can't really snort black tar. But when it comes to snorting drugs, that will take just a hair longer for that to get to the brain to take effect, because basically what happens when you snort drugs is that drug is going to be absorbed through the soft tissue in the nasal passages, and that will go to the brain. Other methods of ingestion, eating a drug. I've known people that have eaten methamphetamine. The issue that people have with that is that when you eat a drug, the digestive processes in the stomach are going to break some of that down, so you might not get the entire high that you're looking for. And then again, it has to be absorbed through the lining of the stomach and make its way to the brain. And it's slower. Digestive processes are going to be a lot slower. The only drug where it's a greater or more impactful high, if you eat it, is marijuana. In comparison to smoking it. If you smoke marijuana, yes, you will experience a high pretty darn quickly. But if you eat marijuana, what's going to happen is that whatever happens in the digestive system increases the potency of the marijuana, and thus the high. But it might take a couple hours for it to take effect. I will go there for a second, but other methods of ingestion of drugs, and primarily I've only known this with meth. I'm sure you can do it with other drugs, but is going to be rectally using the drug. And so that is literally when individuals will insert the drugs into their rectum, and there's a lot of soft tissue down there, and so it's readily absorbed through that soft tissue and makes its way into the bloodstream and then the brain. Also, in regard to alcohol counts under these drugs we're talking about. And I'm hoping this is not trendy anymore, but when I was younger, it was trendy, and it sounds like a great way to overdose, is that people would, and you could be male or female, I guess, and do this vaginally or rectally, but people would soak tampons in vodka And if you're female, they would commonly insert them vaginally. Male, you would insert them rectally. Because again, there's very, very soft tissue, and so it's going to be absorbed directly into the bloodstream and make its way to your brain. Now, that's incredibly dangerous. This is a great way to overdose and die. Because what happens when somebody drinks alcohol is that, again, it's going to go into your stomach, and again, some of it's going to be broken down, like in your liver. And so some of it is not going to take effect, whereas the rest of it is going to be basically absorbed into the stomach lining and then make its way to your brain. But it's kind of broken down a little bit. You're not getting all of the alcohol sent to your brain. And so as a result of that, you have less of a chance of overdosing. Plus, when you do it that way as well, if you do experience alcohol poisoning, you either get your stomach pumped or you throw up. And so thus you're expelling all of that alcohol and the poison from your body. Now, if you soak a tampon in vodka and insert it anally or vaginally, what's going to happen is there's no breakdown. You're going to absorb all of that drug through those soft tissues. And what's going to happen is all of that's going to go to the bloodstream and to the brain. And so as a result of that, you have a much higher chance of overdosing and dying if you use alcohol in that manner instead of drinking. It terrifies me. And plus, I'm guessing medical professionals would have a way to possibly save your life. I'm sure there's a way that they can do it. It's just going to be more difficult than if somebody drinks alcohol. I'm hoping this is not trendy anymore. And anybody that's out there, don't get any ideas. I mean, for a while when I was younger, people were like vaping alcohol. Just like the things people think. Anyways, yeah, so those are the methods of ingestion of drugs, because I'm sure everybody wanted to know that. Okay, so again, once in the brain, again, heroin's going to be converted to morphine as a result of enzymes, and then it's going to attach to opiate receptors, and I know it's kind of hard to see, but in the green areas. And so that's going to also include the VTA, the ventral tegmental area, and the nucleus accumbens, and that's going to activate that reward pathway into the prefrontal cortex. And so that the reward pathway is going to be activated, but then what's also going to be activated is at the bottom of the brain stem going down into the spinal cord, there are opiate receptors down there as well. And so that's why these opiates, they're not only pleasure-inducing, but they're, again, pain-reducing as well, because they activate those neurons in like the spinal cord, which is going to control a lot of your pain. It's going to block basically that pain, the gateway with, oh God, what am I thinking? It's going to block a lot of those nerves associated with your body, and so thus blocking pain, getting to your brain so you don't notice it. Yep, we just covered this. Okay, we're good on that. Yes, rats self-administered heroin, same concept as I was talking about. Okay, so I'm just going to write a couple of definitions up here, and I realize I should have done it with my other classes, but I think it helps. Okay, so when we're delineating between these concepts, I'm going to say substance use is going to be, it's a proper / legal use of a substance. Okay, so this is also based on social norms, because in the state of Nebraska, for example, marijuana is not legal in the state of Nebraska. And so immediately, if somebody uses marijuana, it's not substance use. It's going to be what's known as substance abuse, because it is illegal. But if you do it in Colorado, it is substance use, because you can legally smoke marijuana in Colorado. Okay, substance abuse is going to be just the misuse or illegal use of a substance. Again, marijuana, that's a pretty easy example. When it comes to alcohol, it's a little bit different because, again, in our society, it is almost expected that you use alcohol. You go to like a wedding, people are going to be drinking. You go to a birthday party, people are going to be drinking. You go anywhere in society, you go to a football game, people are going to be drinking. It's just almost expected if in social situations. We call that substance use. It's going to take a lot of alcohol use in order to get to substance abuse. I mean, we might have to be talking about like excessive binge drinking in order to get to the level of like substance abuse. We might even have to get to alcoholism because alcohol is so acceptable in our society. But again, as soon as somebody uses marijuana in the state of Nebraska, it is literally substance abuse because it is illegal. And then again, down here, then we kind of get into like addiction. And this is when, and again, we talked about it, there's a compulsion, and it can be like addiction / dependency, substance dependency. And this is when the body requires the drug to properly function. That's going to be the difference between all three of these. Because just because somebody is abusing substances doesn't mean that they're necessarily addicted or dependent on the drug. So you kind of have three tiers here. And it's kind of based on like medical aspects of it, but it's also based on society. Okay, because then we have tolerance. When drugs like heroin are used repeatedly over time, tolerance can develop. And so tolerance is basically when you don't respond any longer to a drug in the way you initially responded. Okay, this is even like with caffeine. We can talk about caffeine. Caffeine is technically a substance that is included in the DSM. We can talk about caffeine, okay? Because I will go through like caffeine fasts where like I don't use as much, I like pull back on the amount of caffeine I use, and then I go back to like a month later, I go back to using like caffeine and I have one energy drink and I am cracked out. Like I'm gonna go run a frickin' marathon, then I'm gonna be depressed and crash. That's what happens. But if I continue to drink one energy drink per day, I'm gonna say by about day 7, it's not gonna work as well. So maybe I need to add another energy drink. Now I'm drinking one in the morning and one at noon. Because again, that first one is not working as well as it used to because my body's like, okay, we're adapting to it. Basically, we're adapting to it. And in regard to heroin, the same thing happens. This is why every simultaneous high that people get from heroin is not going to be as powerful as the first. It will never be. But with heroin, tolerance develops very rapidly, especially to the analgesic effects of the drug. And so even if you're like prescribed like Vicodin, Oxy, or Hydro, after a certain amount of time, it's not going to work as well, and you might have to up your dosage. But tolerance to drugs can be produced by a variety of mechanisms. In the case of heroin, though, it's like at the level, like cellular level. So when morphine binds to opiate receptors, it's going to trigger the inhibition of, it's an enzyme, adenylate cyclase. It's an enzyme that orchestrates several chemicals in the cell to maintain the firing of impulses. So it's going to inhibit that. But after repeated activation of the opiate receptor by morphine, that enzyme is going to adapt to it. And so as it adapts to it, the morphine is no longer going to cause the changes in cell firing. So your cells in your body get to the point where it's like, okay, we're used to this, we know how to work, and until you increase the dosage or use a more powerful drug, it's not going to give you the same high. I think that's about the easiest way I can explain that. Let me see here. I talked about that. Okay, so again, and on the next slide, it's going to tell the difference between dependence and addiction. Depending upon what area of field or what field you're working in or studying, these terms are going to be used a little bit differently. So this is just in the context of this class. But as people continue to use heroin or any opiate or really, I'm going to say a variety of drugs, dependence is also going to occur. It's going to develop when the neurons are going to adapt to repeated drug exposure, and again, kind of developing tolerance, and they only function normally in the presence of the drug. So this is literally when, in order to feel normal, you have to use the drug. So this can be like people who, again, they might be severely alcoholic, and in the morning they literally have to use the drug in order for them to stop their shakes. And when the drug is withdrawn, again, you're going to have withdrawal symptoms. They can be mild. Oh God, I don't think withdrawal from caffeine is mild, but I've also never withdrawn from heroin. I don't use it, I've never used it, so don't think that. But Caffeine, again, withdrawal from caffeine is going to be like headaches. The headaches are terrible. You're going to possibly experience depression, you're going to sleep a lot, things like that, or even life-threatening. That's going to be alcohol. One not so fun fact is that the only drug that you can die from the direct withdrawal effects of is alcohol. Now, there are people that die during withdrawal from other drugs, but it's usually the result of some medical complication or something else that's going on. In regard to just the withdrawal, alcohol is the only one from which you can die. And so that's why I recommend, like, if you have a friend that is an alcoholic and they're trying to withdraw from the drug, take them to the hospital, please. Because what happens when somebody withdraws from alcohol after, again, chronic and extreme use is that they're at risk for DTs. Those are called, they're also what's known as delirium tremens, and it's basically seizures. It's basically seizures that can happen as a result of this withdrawal, and that's what can kill you. And so what happens if you get them to a hospital is that what they'll commonly give them at the hospital is Ativan, or some other benzo like that, and what that does is it decreases the severity of the DTs, thus making the withdrawal a little bit easier and really helping them not die. Okay, yeah, this is known as withdrawal syndrome. You can be diagnosed with that, and in the case of heroin, it can be very serious, and the abuser will use the drug, again, to avoid the withdrawal syndrome. Again, this is part of the reason that it's hard for people to stop, is because those withdrawal symptoms suck. And so, like, the pain associated with the withdrawal is sometimes too difficult for people to overcome, and so they use, and then the withdrawal symptoms go away. And again, that's just reinforcing, like, the continued usage. And so it can be, it's a tough cycle to get out of. Let's see here. Okay, when it comes to dependence, the development of dependence to morphine, it involves certain areas of the brain that are kind of away from the reward pathway. So this can include the thalamus and the brainstem. The parts of the reward pathway involved in addiction are shown for a comparison. Many withdrawal symptoms from heroin or morphine are generated when the opiate receptors in the thalamus and brainstem are derived of morphine, and that's what's going to cause those physical withdrawal effects primarily. Okay, looking at addiction versus dependence. Okay, so different parts of the brain are responsible for addiction and dependence, but again, in regular society, you guys are probably going to hear these things, or hear these concepts used interchangeably. But the areas of the brain underlying addiction are going to be associated with the reward pathway, and again, that reward pathway is what's going to encourage the compulsive use of a drug, because again, that dopamine, which is pleasurable, it's also going to remind somebody like, hey, let's do this again, let's do this again, let's do this again, thus the compulsion to continue to use. And those underlying the dependence to morphine, okay? So with dependence, it's going to be more so the brain and the thalamus, or brainstem and the thalamus, that are going to cause those withdrawal effects. So you can be dependent on morphine based upon neurology without being addicted to it. But if one is addicted, they're most likely dependent as well. So that's where it's kind of, people use this synonymously because in a lot of cases, they're going to be both. This is especially true for people being treated chronically with morphine, like for pain associated with like cancer. They may be dependent, like if the drug is stopped, they suffer withdrawal symptom, but they're not necessarily compulsive users of morphine, and so they're not addicted. So that compulsion is going to be the biggest part. They're literally taking morphine as a result of prescription, and so it's not conceptualized in the same way as like recreational use. So that's the way that they delineate between addiction and dependence for the sake of science. We can do this. All right, cocaine. Because why not? Okay, so we talked about heroin, and heroin is a central nervous system depressant. It's going to slow things down. Whereas cocaine, we're going to speed things up. And yes, it is addictive, and you can become addicted. Yeah, but with the advent of crack, the rate of addiction to cocaine has increased considerably. Crack cocaine is nothing more, again, than a derivative. It's a way to cut your coke, let's be honest. And so the way that what people do, and again, because you can sell crack for cheaper, so it's going to be more economically viable for a variety of customers. And also, you're getting more bang for your buck if you're the dealer because you're cutting your crack, or you're cutting your cocaine. And so, how people will make crack cocaine is that, again, they will take some cocaine, they'll and put that in a frying pan, and then some baking soda and a little bit of water, and they'll fry it up. And literally, the reason that they called it crack was because of the crackling noise that it makes when it is cooked. And the result of that are going to be little crack rocks. And in regard to freebasing, people can commonly, they will smoke. In general, most people will snort cocaine. Some people will smoke cocaine, but most people will snort cocaine. But when it comes to crack cocaine, I've only heard of it being smoked. I don't know if you can do anything else with it, for the most part. But with crack, it's commonly smoked out of a crack pipe, or it is freebased. And so when you do that, basically what happens is that you just have a piece of tin foil, and you have a lighter, and then you have like a straw. You light that crack, like you heat it up, it's going to, that's going to result in a vapor released from the crack, and people inhale that. I'm sure everybody wanted to know that as well. Okay, so the difference between snorting and smoking cocaine. So there's kind of different addictive liabilities, and this just shows the difference between smoking and snorting drugs in general. But yeah, historically, coke has involved snorting the powder form, that's hydrochloride salt. When it is processed to form the freebase, also known as crack, it can be smoked. Heating the hydrochloride salt form of cocaine is going to destroy it, and so that's why when people like smoke cocaine, it doesn't make sense because it destroys the active ingredient. Anyways, but you can with crack because you are releasing that from the substance. Okay, but the freebase can be volatilized or basically heated at high temperature without any destruction of the compound because of, literally the chemical compound that is created as a result of cooking crack. And smoking gets the drug to the brain more quickly than the snorting does. Snorting is going to require the cocaine that travels from the blood vessels in the nose to the heart, where it gets pumped to the lungs to be oxygenated. So, what's the snorting? Yeah, snorting, again, it's going to have to, again, go to the blood vessels, which is going to go to heart, which is going to have to go to the lungs, which is going to go back to the heart, which is then pumped to the brain. But again, this happens in seconds. It happens in seconds. So when we're talking about like the difference between these, we're minuscule amounts of time. Okay. And the oxygenated blood, that's going to be the red arrows, carries the cocaine. Carrying the cocaine travels back to the heart, then it's pumped out to the organs of the body, including the brain. But smoking bypasses most of this. The coke is going to go from the lungs. Again, if you're smoking, you're inhaling it into the lungs. So obviously, it is going to go directly to the heart and pump to the brain. So it's like taking a shortcut, so to speak. The faster a drug with addictive liability reaches the brain, the more likely it's going to be abused. Primarily because of how quickly reinforcement happens. If there's a delayed reinforcement, it's not as abusable, but if there's immediate gratification, that's going to be more abusable. So the time between taking the drug and the positive reinforcing and rewarding effects that are produced can determine the likelihood of abuse. Again, that immediate gratification is going to enhance the chances that somebody abuses something, in comparison if there's like delayed gratification. Okay, so that kind of shows like the difference between the smoking and the snorting of a drug and how it gets to the brain. And when it comes to cocaine, when somebody smokes crack or snorts cocaine, and again, so when it comes to these two drugs, there's not a lot of differences, even though we've treated it very differently historically. It's basically the same drug. It's just that the cooking of the cocaine, turning it into crack, it releases that like those hydrochloride molecules, allowing it to be smoked. But otherwise, they're very, very similar drugs. Okay, So yeah, when people use cocaine or crack, it's going to reach all areas of the brain, but it's going to bind to sites in some very specific areas. So yeah, it's going to bind to like the VTA. Like again, as we keep talking about, it's going to bind to the VTA, ventral tegmental area. That's what's going to release dopamine, go to the nucleus accumbens, and then up into the cerebral cortex. Or I guess the caudate nucleus. That's rolling over the limbic system. And the binding of the cocaine in other areas like the caudate nucleus can explain other effects like increased or repetitive behaviors. So that can be things like pacing, nail biting, kind of like nervousness that can come along with the cocaine use. Okay, so it's going to bind to sites and areas of the brain, again, rich in dopamine synapses like the ventral tegmental area, the nucleus accumbens, like we talked about. The transmission can be seen in the close-up of the synapse in the nucleus accumbens. Dopamine, that's going to be in the terminal, again, floating around, is released into the space, into the synaptic space. The dopamine is going to bind to dopamine receptors and then taken up by the uptake pumps back into the terminal. Then what happens is cocaine, in the yellow, is going to bind to the uptake pumps and prevents them from transporting the dopamine back into the neuronal terminal. So it's basically blocking the reuptake of dopamine, creating more dopamine in that synaptic space to be used by the receiving neuron, thus increasing the availability of dopamine in the brain. So more dopamine builds up in the synaptic space, causing a net increase in dopamine neurotransmission. So your brain is it's constantly pumping dopamine. It's the same effect with morphine. More morphine increased dopamine release from the terminal to produce more dopamine in the synaptic space, thus flooding your brain with dopamine. And thus enhancing the pleasurable effects, and the reminder that you need to do this again. Okay, let me see here. Yes, it's going to activate the reward system, similar to that of your opiates. But if you repeatedly use cocaine, the body's going to rely on this to maintain rewarding feelings or release dopamine. And so what can happen over like a sustained use is that it makes it harder for the person to feel positive reinforcement or pleasure of natural rewards. So like food, water, and sex are no longer going to have the pleasurable effects they once did. And so people are only able to feel pleasure or normal by using cocaine. So that's part of the reason why somebody becomes dependent. And in the absence of cocaine, you experience anhedonia. And so this is when, like, again, I said, like, tacos and puppies don't feel good anymore. The things that used to feel pleasurable don't. And one of the withdrawal effects is going to be depression. And so to avoid this, you go back to cocaine. And unlike the example for morphine, being addicted to coke, again, craving it or wanting to compulsively use it, and dependence, that's going to be the withdrawal effects. Both involve structures in the reward pathway. So that's going to be a little bit different than morphine, which is going to include the dependence is going to be associated with the thalamus and the brainstem, and the addiction is going to be associated with the reward pathway. Both the addiction and the dependence when it comes to coke is going to be involved with the reward pathway. Or the addiction and the dependence is going to be just involved with the reward pathway. So those are the different structures that each drug is going to work on with the brain in regard to addiction and dependence. Yep, the rats will administer cocaine to themselves when that nucleus accumbens is activated. Let me see here. Okay, so when it comes to other, I should just stop. Do you guys have any questions about this? I'm just rolling. Just rolling. Okay, in regard to other drugs, here we go, because, again, I just went over one stimulant and one depressant. But the reward pathway is shown here along with several drugs that have addictive potential. So like just as heroin or morphine and cocaine activate the reward pathway in the ventral tegmental area and the nucleus accumbens, again, these areas, heroin, cocaine, activated, whoop, bunch of dopamine. Other drugs, nicotine and alcohol, activate this pathway as well. But sometimes indirectly, sometimes through the globus pallidus, an area activated by alcohol that connects to the reward pathway, but it's still the reward pathway. So the utilization of nicotine and alcohol are going to activate that reward pathway as well. even though each drug has a different mechanism of action, they're going to increase the activity in the reward pathway by increasing dopamine transmission. That's why these things feel good. And we have a reminder to do this again later. Because of ways our brains are designed, and because these drugs activate particular brain areas, for reward they have the ability to be abused, and thus addiction is truly a disease of the brain. It is altering the function of like the reward pathway and the way we think about these substances. So, and that's another thing I will mention in regard to like addiction and dependence. There are not, I can't say this absolutely, but in general, most people do not use a drug for the first time thinking that I'm going to become addicted and dependent on it. Like, that's not the intent. I don't know anybody who, again, I know this is anecdotal, there's probably somebody out there, but in general, most people are not using a drug thinking like, yes, I'm going to become addicted to this. That's not the purpose of like their first use. There's so many reasons why people will start to use drugs. Too many to mention. I do understand that in most cases it is a choice, but in regard to the intent behind that choice, it's never a thought, rarely a thought, that, hey, I'm going to become addicted to this. Or I'm literally setting myself up for my brain to develop a disease. That just doesn't happen. Okay, so when it comes to the DSM-5 text revision, here we go. Okay, big stretch. All right, so we have all of these drugs in the DSM-5 text revision, and not only these, but we have others. So if there's another drug, it can be included in other. So yes, we have alcohol, we have caffeine, we have cannabis, we have our hallucinogens, inhalants, opioids, sedatives, hypnotics, stimulants. Tobacco is really interesting because I don't really understand why they have tobacco and not nicotine. Tobacco is not addictive. Tobacco with nicotine in it is addictive, but tobacco in and of itself is not addictive. Nicotine is the active psychoactive substance in tobacco that is the addictive chemical. But so that's interesting because I would hope in the future they change that to nicotine, primarily because of like vaping. There is tobacco in vaping, in vapes, in vape juice. There isn't. And so I think we need to update that to nicotine because that is the addictive psychoactive chemical. And then other, which can encompass anything that doesn't fall into these categories. All right, so in regard to substance use disorder, so now we're into the DSM. We talked a little bit about how these drugs work in the brain. Now we're and showing that this is a disease of the brain that has psychological effects, changes the way that people are able to function in society. These are the definitions of terms associated with the DSM-5 text revision. So how we can conceptualize these things. So in regard to a substance, so how do we conceptualize a substance that is going to be included? It's any natural or synthesized product that has psychoactive effects and can change perceptions, thoughts, emotions, and behaviors. So yeah, even like with caffeine, oh my God, if you guys give me a Monster, I am going to run around the school 6 times. In comparison, I don't even know what else to say. I will be sprinting back and forth in this classroom. In comparison to if I don't use caffeine, I will be walking slowly across this classroom. So that it does, any of these substances are going to change these things. That's what makes it psychoactive. Substance use disorder. This is when there's a pattern of negative symptoms resulting from the use of a substance. Diagnosis does not require physical dependence. It does not. It just requires a certain amount of symptoms. Literally, you just need 2 symptoms in order to be diagnosed with a mild substance use disorder. And probably most of us in this classroom could be diagnosed with at least 1 substance use disorder. Probably caffeine. At least. At least. Anybody that vapes? Probably. I don't know if it's. This tobacco one is weird. Anyways, at least 1. Substance intoxication. So we have a substance use disorder, and then we have substance intoxication, and then we have substance withdrawal. So you can get 3 diagnoses in this category of diagnoses. But substance intoxication is what it sounds like. It's when somebody is actively using a drug right now and they're experiencing the effects of the drug. So if somebody was like drunk right now, you would be exhibiting certain symptoms. Yes, it refers to the development of a reversible, because again, you let it get out of your system, it stops. Substance-specific syndrome of mental and behavioral changes that may involve altered perception, euphoria, cognitive impairment, impaired judgment, impaired physical and social functioning, mood lability, belligerence, or a combination. Because yes, that's what happens when people use certain drugs. There's alcohol, heroin, coke. Taken to the extreme, intoxication can lead to overdose, significant morbidity, and risk of death. So this would be useful for somebody that they walk into their therapist's office or psychiatrist's office and maybe they're high. Maybe they smoked a bowl before they came in, or maybe they drank a beer out in the parking lot. This is useful for that because it shows active usage. And the effects, the substance, when somebody's intoxicated, what type of intoxication effects they experience are going to be dependent on like the type and amount of substance ingested, their biochemistry, including tolerance, and the setting. Which can, especially with drugs like your hallucinogens, marijuana, that can affect how people kind of experience those drugs as to where they're taking it at or using it at. Tolerance is going to make a big difference. So this is a story that one of my former colleagues told me, in that, this might be too old for you guys, but Henry Hill, who is used to be part of the mob. He is the main character, or he is what Goodfellas, the movie Goodfellas, directed by Martin Scorsese, and Ray Liotta is the main character in it. That is based on his life, Henry Hill. Anyways, Henry Hill went into witness protection, and he was placed in North Platte, Nebraska, which is a good place to go into witness protection. Nobody knows we're here. Anyways, he ended up on probation. He also did things, like he trafficked some coke in and things like that. Mob lifestyle never left him, but he was on probation and he had such a high tolerance of alcohol that he would be able to walk into a meeting and he would be given a breathalyzer and he would be walking, talking, just like nothing's wrong. He could be given a breathalyzer below a 0.32. Now, if I had a blood alcohol content of 0.32, I'm dead. My body would not handle that at all. And that's because of the difference in tolerance. I am going to be comatose, Henry Hill, walking, talking as if he's totally sober. That's what tolerance is going to kind of indicate. And yeah, the type and amount of substance ingested. Yes, did you drink 1 beer or did you drink 30? Did you use heroin or did you drink a beer? That's going to be a big difference in the extremity of intoxication effects. Okay, we also have substance withdrawal. I'm going to try to summarize this. But it's, again, those substance-specific physiological symptoms that somebody has when they stop using a drug. When they stop using a drug. And to be classified as a withdrawal disorder, the withdrawal must cause the patient significant stress or impaired functioning, whether it's social or occupational. Yes, if you're going through withdrawal, whether that's caffeine, nicotine, heroin, whatever it is, there's going to be some distress. It's not going to feel good. It's going to suck. So it might be getting in the way of getting out of bed, maybe you've called in sick a couple days. Most people with withdrawal recognize that if they use the drug, they're going to reduce their symptoms. Again, you use the drug again, your withdrawal symptoms go away, which is why a lot of people will relapse pretty quickly. But some people with withdrawal symptoms have a disorder. Some drugs, particularly opioids, sedatives, and stimulants, can result in withdrawal symptoms even when taken as prescribed for legitimate medical reasons for brief periods. So like if you are just put on like Vicodin for 7 days after you get your wisdom teeth on and then taken out, surgically removed, and then you stop using after those 7 days, you can still have withdrawal effects because they're that powerful. And they can develop following inappropriate medical use and are not considered criteria for diagnosis of a substance use disorder. But it's still withdrawal. It's just that you can't be diagnosed with it. And it's not considered a substance use disorder if this is what a doctor has prescribed you. And it's when somebody withdraws from a drug, the symptoms they're going to experience are going to be the opposite of the intoxication symptoms. So, for example, when it comes to like heroin, heroin again is a central nervous system depressant. It's going to bring you down. It's going to slow you down, possibly put you to sleep, make you feel good. Some of the withdrawal effects of heroin are going to be like your central nervous system is jacked up. You're not going to be able to sleep. You're going to be jittery. I mean, you're possibly going to be irritable. You're probably going to throw up too. But again, your central nervous system is totally jacked up. Just jacked up. Hot, cold flashes. Everything is on high. In comparison to like with Coke. People stop using Coke. They want to sleep all the time. They're lethargic. They're going to have a hard time getting motivated. So again, it's going to be the opposite of the intoxication symptoms. Okay, this is a great place to stop. We will continue this